You may have heard of hallway medicine, patients treated in corridors because no rooms are available. Now Alberta is bringing in waiting room physicians to help out in struggling emergency departments.
You can initiate blood work and even do some diagnostic imaging tests that could be ordered from a patient sitting in a waiting room so he can get care going.
The change comes after 3 patients died while waiting for care at the Grey Nuns Hospital last month. It's one of 100 initiatives the hospital's minister says are underway to help relieve significant pressure on the system. Triage liaisons will start helping out in 6 Alberta hospitals immediately, those centers operating at 102% capacity, far above the ideal rate of 85 to 90%.
They will work directly alongside triage nurses and emergency physicians to expedite assessments, support diagnostics, and begin care for patients in the waiting room where appropriate.
To put it really simply, it's like putting on a kind of an old Band-Aid on a big, huge gaping wound. It might stop the bleeding a little bit.
Dr. Paul Parks points out triage liaisons have been used before. He believes the only way out of this crisis is more hospital beds and more staff. Former MLA Dr. Raj Sherman taking to social media to demand UCP and NDP MLAs return to the legislature for an emergency session on health care.
If that's what it takes, then get to it. Do your job. Help us out. People are dying in our hospitals.
Dr. Sherman also calling for a, quote, independent authority of experienced healthcare operations experts to take over the system so it can restore patient safety, depoliticize healthcare, and rebuild public trust. This political scientist doesn't see an emergency session happening, but says the Premier and her health ministers are ultimately responsible for hospital capacity shortages.
They've made a promise, they've made changes, and it looks like things are moving in the wrong direction. They aren't improving, they're getting worse. And some of that does fall squarely at the feet of this particular government.
The press secretary for the hospital's minister responded to Dr. Sherman's demands with one word Friday: no. The government insists they have plans to reorganize and build more spaces without bringing MLAs back early or handing over the system. From Edmonton, Sean Amato, City News.